Welcome back to Amplified. The nation's 2 million domestic workers have been an integral part of our economic health. From caring for our children or disabled family members to providing community-based care and performing work in our homes, they have been diligently working throughout the roller coaster ride that this pandemic has been, even when it meant putting their own lives on the line. The surges of COVID-19 drove states to revise their supplemental sick leave to accommodate longer quarantine periods and the lingering side effects of the virus. But many of those policies have expired. As the Omicron variant sweeps the nation, domestic workers are back at square one. Without the luxury of paid sick leave, they're having to pick between their health and their paychecks. As co-founder and executive director of the National Domestic Workers Alliance, Aisha Mills has been devoted to restoring the dignity and fairness to domestic employees, and she is here tonight to discuss their path forward. Aisha Mills, thank you so much for being back with us here on Amplified. You know, I want you to just start off by talking about the bold commitments that President Biden made when he came into office, including lending more support to domestic workers who help restore the pandemic-hit economy by increasing pay, expanding access to health care, and, of course, implementing the coveted paid sick family leave. So now that we're almost a year into the presidency, how do you think that domestic workers are faring under Biden?
I think it's been a real roller coaster. Domestic workers have received some direct support through the child tax credit, and through many of the measures in the American Rescue Plan, but it is rough for domestic workers. We're talking about the nannies, the house cleaners, and the home care workers who 82% of them earn less than $15 per hour. So as expenses go up and the Omicron variant takes hold, childcare centers close down, and people still don't have paid leave. We're just in a really tough situation, and I think it's oftentimes the workers, like domestic workers, who have the least access to resources that end up bearing the brunt of these crises over and over again, which is why Build Back Better is so essential. With Build Back Better, we're talking about more access to affordable childcare, which domestic workers desperately need. We're talking about raising wages for home care workers, who are an essential workforce for our aging parents, our loved ones with disabilities, making their jobs good jobs for the first time in history, paid leave, paid family and medical leave, so that when we need to take time off from work, we can actually do so without having to worry about losing our jobs permanently or our income. That's what's at stake with Build Back Better. It is nothing short of transformative, and it's also urgently needed in the wake of the ongoing pandemic we're faced with.
Let's talk about the sick leave policies. Paid sick leave policies varied from state to state and even by company. In the wake of COVID-19, that paltry sick leave just obviously wasn't cutting it for folks. So some states had to increase the number of sick days. Last March, California's Governor Gavin Newsom signed a bill into law that mandates companies with more than 25 employees to offer as much as 80 hours of sick leave related to COVID-19. Well, this actually ended in September. So make the case for us about why California and other states should actually restore paid sick leave for workers, especially with the threat of the Omicron variant, even as we, don't have Build Back Better just yet.
Well, when you have our essential workers, who are also disproportionately women and women of color, who are also mothers and caregivers for their own families and in their own communities, when they don't have paid sick time, it is a risk, and it further reinforces the public health risks that we all face in a pandemic. When your nanny cannot stay home because she is sick, it has implications for everyone involved. When your home care worker has to make impossible choices between going to work and keeping themselves and their clients safe, but needing to put food on the table, these are impossible choices that we have put our caregivers and domestic workers in a position of having to make every single day, and actually giving people paid sick leave, paid time off can address that. And it seems so obvious that we need to do that, especially for the essential workers who are interfacing with our families on a day-to-day level.
You know, I just love talking to you because you make so much sense. When you are explaining the complicated situation that the people who are literally the backbone of our families for sure, but our society writ large are in, to me, it's a no-brainer that policymakers should want to do something to support them because they're caring for and supporting us. So what do you say to opponents of expanding paid sick leave, for example, who point to other programs instead, like exclusion pay, which gives employees regular pay for 10 or more days if they can work, or take workers' compensation for the 8 weeks of paid family leave, or like, you know, people are trying to just put together different solutions that aren't exactly what you're talking about. What do you say to opponents?
These are problems that have very simple, clear, tried and true, tested solutions, and we should not be doing anything fancy or magical. It's not necessary. These are solutions that have been tested and should simply be implemented. And I will say that, you know, I'm very concerned at this stage in the pandemic that we're going to be faced with another huge exodus from the workforce of women and women of color who are struggling with keeping their families safe, taking care of their loved ones, their kids, their aging parents, and work. While daycare centers, we know, are closing down, schools are closing, opening, closing. There's so much instability. Lawmakers, employers should be looking for ways to institute stability. And passing Build Back Better is a step. Enacting paid sick leave is a step. These are very clear solutions that we just need policymakers with the sense and the courage to implement.
I'm curious, you know, about what's going to happen with Build Back Better. There's so much there. I always think of it as this, you know, kind of omnibus social spending bill. We've been talking about leave policy, but it also, you know, domestic workers make what, an average about $12 an hour and are 3 times more likely to be living in poverty when compared to other workers. So I'm curious how Build Back Better would address that. But then there's so many people who say we can't get it all done at once. We can't just do the whole bill, so maybe we should pick and parcel out pieces of the bill. I'm curious, if Build Back Better were to get broken up, what are some of the key provisions, policy measures that just have to get passed right now to deal with the issues that we're talking about?
Well, right now, when you ask any family out there, including many of the people who are tuning in and watching us right now, they will probably tell you that among their top concerns are rising costs and COVID. And COVID because of all the economic and also health implications of it. And Build Back Better actually addresses those concerns head on by making sure that the cost of childcare, which is one of the biggest fixed costs for families, actually decreases and childcare becomes much more affordable and accessible. That the care workforce, where we are facing labor shortages all over the country when it comes to care workers, that they can have good jobs, sustain in these jobs, and take care of their families too, which will then enable all of us to stabilize in terms of the COVID realities of having to worry about whether or not we need to leave the workforce because we don't have caregiving supports, or the many labor shortages that we're dealing with across essential industries because people are grappling with care for their families. So these are issues that Build Back Better addresses head on with its investments, and I think we should just simply implement. They're good for now in terms of addressing COVID, but they're also really fundamental to securing our economic stability, resilience, and growth long term.
Yeah. Ai-jen Poo, Executive Director and founder of the National Domestic Workers Alliance, thank you so much for being here with me tonight on Amplified. Always appreciate hearing your insights.